this is the Mackenzie kind of stretch. Once again, I'm pretty sure he's like a Kiwi physio. The story goes that somebody came in that had like crippling back pain, and he told him to go lay down on the bed, and you imagine they're going to lie like face up, but instead he's come in and they'll face down, but the bed was one of those adjustable ones, so essentially he's laid face down and he's bent backwards like a banana, and the guys turned around and said, I don't know how this has worked, but I feel heaps better. So it actually made him start to think about back pain and how you could potentially use different movements. So obviously check to make sure this is appropriate for you, but let's say that you have a little bit of back pain or tension. The way that they talk about it is you find something nice and stable, so it's not moving too much, and if you can, you're just going to lie like that, and then start to come up. The idea is that you want to be relaxed with the movement. You're not trying to tense and make it worse. You're trying to be nice and gentle, and just add a little bit of movement and flexion into the spine, and then breathe nice and slowly. Let that kind of relax into that situation. With any rehab stuff, you're meant to feel better after. So if you start to feel worse or you feel worse after it, may not be the right one for you, so make sure you check in with your healthcare professional. But over time, the idea is that you're going to start to feel stronger and better, and you can start to do these kind of things like that. And you're focusing on letting your back stay relaxed and getting that nice kind of rounding through there. And the idea is they imagine that it helps that if you do have a protruding disc, kind of go back into place by making a reverse kind of vacuum through there. If it is the right one for you, by the time you've done a few, you should be starting to feel like a reversal of some of those symptoms. So look after yourself, don't do anything that hurts you, always work with pain-free range of motion. Doing this and going into that pain is not what they're trying to get you to do. You're trying to go to where you feel it, and then over time and repetition, get more and more.